Are you already registered with Wikisana?
Welcome, dear viewers, to our natural medicine format today. The metacarpophalangeal joint of the thumb can sometimes develop osteoarthritis. But what solutions are there? Does it always have to be the scalpel? And is that perhaps a disadvantage? Or are there other solutions? Find out today from our guest, Dr. Harald Burgard. You can look forward to it. Hello, dear Harald. Nice to have you here.
Hello, Karina. Thank you for inviting me.
Yes, we've done interviews time and again also about implants. You have found a very special technique for yourself where you say that I can really help people with it and really save them from having to have an artificial joint or two. What exactly are you talking about?
Yes, we're talking about gold implantation, a technique in which pure gold is applied to the joint capsule from the outside using a needle prick technique for all types of osteoarthritis. So not into the joint, but around the joint capsule. What causes the inflammation and swelling to subside over time, and with it the pain? And the primary aim is to preserve people's own organs, so in this case the joints, and either avoid surgery or delay them. The younger a person is, the better it is to wait with artificial joints, if possible, because they don't last forever. They have to be replaced at some point, and you can't replace them as often as you like. That's why it always makes sense to preserve a joint in the first place, because it's like teeth, on your own teeth. Chewing is always better. And it's the same with joints. You can always manage better with your own joints, better than with artificial ones. And it is often simply the case that not everyone is in a position to have an operation because they are too old, because they have some kind of illness that prevents anesthesia, and so on. And in this respect, it was a great method with which you can achieve pain relief or even freedom from pain for most patients with one treatment.
Now we have I think the metacarpophalangeal joint of the thumb is one of the most complicated, right? Or what can it be?
It's one of the most stressed joints, for example, and one that's under increasing strain, especially in the age of cell phones. You hold the thing in your hand and fiddle with your thumb. We also have more and more younger people now who are developing pain simply because of this overload, because they try to do everything with their thumb.
Okay, what kind of clinical pictures really develop in this metacarpophalangeal joint where you say you can really work with implants? So there are different ones?
First and foremost, arthrosis of the thumb saddle joint, in other words, osteoarthritis in this metacarpophalangeal joint, which then leads to the fact that it really hurts in the long term, that you can no longer make certain movements, that you're restricted in your computer work or cooking or everyday activities, in the appearance of bottles, whatever. And this pain naturally robs you of quality of life and function. And of course, you can try to remedy this in the long term by injecting painkillers, acupuncture, or other conservative measures. Of course, you can also try injecting hyaluronic acid into the joint. This is a very small joint. These are all things that can help with mild osteoarthritis. But if it's advanced, grade 3, grade 4, you won't get any further. And then the only option for many people is either to endure the pain or take pain medication or have an artificial joint fitted, which is not without its drawbacks, especially for the wrist.
You have brought Mrs. Huck here with you. Hello, thank you for your time. Thank you very much.
Yes, with pleasure.
And of course, I'd be interested to hear a bit of the story, because that's exactly the issue with your thumb, with the joint and the osteoarthritis.
Yes, exactly right. Yes, that's how it started for me. I think I actually had osteoarthritis in my thumb when I was 46, which is of course extremely early, and I was injected with cortisone. I did. What did I do? Electroacupuncture. I was given anti-inflammatories, all sorts of things, and nothing helped. And I also tried taking natural remedies, enzymes, and all the other things you can do, and nothing really helped. And I've been hearing about gold for a while. And I have to say, of course, you have to invest a lot of money in it. And then I always thought, should I, shouldn't I? And then it got to the point where a specialist clinic said that the only way is surgery. And I really didn't want to do that. And then I said, okay, now I'll do it with the gold. And that was a year and 2 months, 3 months or so ago.
And how did you come up with the idea that this even exists? Because it's not so well known now.
Yes, actually. I have the Codex Humanum books at home. And it says in there that you can use gold for osteoarthritis. And so I already knew that. And then I did some research and also watched a few videos. And yes, then I decided to go for it.
Super, very nice. And how did the whole procedure and the pain process go?
Yes, the worst thing was actually the injection against pain before the treatment, I have to say. But the doctor's assistant said I could squeeze her hand, and that's what I needed. That was great. And then I didn't feel anything at all from the treatment. So the stitches with the gold pieces, I didn't feel anything at all. And let me tell you, within 2, maximum 3 weeks, I already felt an improvement. The first improvement was that the heat and inflammation went away. Because apart from the osteoarthritis, you can't do anything anymore. So I could no longer pluck grass in the garden. That's how bad the osteoarthritis was. Because the second story was that it was always miserably hot. All you ever wanted to do was cool, cool, cool. And after 2 to 3 weeks, it was as good as gone for me. And then it took a few more weeks. And then the pain was, well, at least half as much. Today, when I do have pain, it's just a joke. So really, I can do everything with my wrist or thumb again. It still grinds, but Dr. Burgard also said at the time that it can't go away because the bones rub against each other. But the pain is 99% gone.
Very good. Great. So I'm still a bit of a fan of regeneration. I mean, if you have the books, I'm sure there's a lot more in there about building up cartilage. It would actually be exciting if you were now pain-free, already had the effect of the gold in your joints, and then perhaps really went back to it and rebuilt the cartilage. Even if that's not possible. We've often heard that, but there are also many counterexamples.
Yes, we learned in medicine. There's always someone for whom something is possible or something happens that has never happened to anyone else. When you had the treatment and then went home in the evening, were you in more pain? What was it like?
No, because the injection was so strong. So it worked. So I didn't have any pain.
Yes, okay. So the effect of the injection normally wears off after an hour. It's just that, because we don't break anything, the technique means that maybe 1 in 15 patients needs a painkiller in the evening. But most people say, okay, it was fine, we didn't need anything. Bruising or something. Was there something there?
I actually did have that. I had a bruise, but I think it was within reasonable limits. Not scary in any way.
Yes, okay.
But of course, I think if an injection goes in somewhere, there's bound to be some bruising.
That's a completely normal side effect that can happen. Of course, you always have to say that there's not so much room on the wrist, on the base of the thumb. And if I make several incisions there, it is inevitable that there will be a little bleeding into the tissue. But the body breaks it down, and then it's done. And the next day, you were able to remove the patches. What was that like?
Yes, I was surprised because I didn't really see anything apart from the bruise. But it wasn't there the next day. It only appeared after 2 or 3 days. You couldn't see anything of the operation.
Exactly. So these small holes are usually closed after an hour or 2. So they actually start to close up after seconds. And you often can't see them at all after months. In other words, you can't see them at all.
And with what kind of tool?
With a needle.
And that's where the gold is in the front?
Exactly. These are special needles into which we insert these pieces of gold and which we then push under the skin into the joint. Depending on the situation, there's not much room at the base of the thumb joint. But in the knee or hip and so on, you go 8, 9, 10 centimeters deep. You have to get to the capsule. And because these are just pinpricks, it's a minimal procedure that generally doesn't get infected or anything. And we've also seen that we do the procedure like a major operation. Everything was covered with green cloths and red paint and satisfactions and such, so that nothing happens. Yes, and if you pluck grass today, can you do that?
Yes, no problem. Really no problem at all. I can do anything. I can play the guitar. Everything.
Wow.
Yes, super nice. Unbelievable, isn't it? How limited. So how many years did you have the problems with the pain?
4 years. 4 years with an increase.
Was it the right or left hand then?
My left hand, but I'm right-handed, but still.
Yes. I think the pain afterwards is also the issue, isn't it? Which is also a burden, because you're constantly blocked in everything you want to do or take action.
So it's just like that, pain or no pain. But some things were no longer possible. So picking up a pan, that's no longer possible. And now I can do that again without any problems. I can pick up heavy pans again.
Yes, you can see what an effect such a small thumb actually has.
Yes, unbelievable.
And these are the things, the functional limitations, the pain, and then the restrictions on quality of life. Now, with a wrist like that, with a thumb, you often think, well, not a lot can happen. But when it doesn't work, you only realize what impact it has on your life. With the knee, you hear much more often that something hurts. But we see thumb metacarpophalangeal joint problems relatively often. And that's also a place where you can't easily insert a joint. It hasn't been possible for that long. With the consequences then, surgical sequelae, possible infections, that can now really grow, and so on and so forth. We don't have that with gold implantation.
Yes, great. Well then, what else I would be interested to know? Did you feel anything else from the gold implants, generally felt in your body? 1 or 2 people still feel a little bit, even in other places, right? We also sometimes had patients who said that I generally had a bit of... What was the last time did someone say something that they could still feel?
Yes, but one lady said that the other knee also felt better. But it's just that when I put gold on a joint, it really only works locally.
Okay.
And if someone has an operation on their right knee, with gold, for example, and they have an improvement on their left knee, then it's usually because the other side is relieved because they can walk on their right knee again.
Yes, okay.
So we see a systemic effect. We don't actually see a systemic effect with gold implantation, but really only a local effect. But what you just said, Mrs. Huck, the inflammation, the burning, the heat, that's going away. Yes, my wife once reported on her foot in one of the programs, and the first thing she noticed was that the burning sensation in her big toe, which she always had when doing sport and so on, went away, until afterwards the pain had completely disappeared. It starts slowly, and that's what you said, it builds up slowly. It starts, and then it takes a few weeks, or even a few months in some cases. So we've already seen patients where the pain was only gone after a year or a year and a half. In the case of one patient, it was actually within 3 or 4 months. But sometimes it's quick, sometimes it takes longer. Depending on the body, depending on the immune system, depending on the other stresses you have back and forth a bit. You also had, back then you said, you had also tried turmeric as a strong anti-inflammatory substance.
That didn't help either.
And then you also had sound wave or sonotherapy.
Exactly, that's right too. The whole program, everything you can find.
Were there any short-term improvements or none at all?
No, none at all.
It was said at the beginning that gold implantation simply works through the acupuncture effect. We've been away from that for a long time. In 2002, scientific studies showed that really gold does have the effect. And if you proceed in the same way as we have done now, then you have the great advantage that you are doing a treatment that gold remains effective for life. Do you notice anything about the gold I put in there?
I can feel the gold from the outside. When I go over it with my other hand, I can feel the pieces in a few places. Yes, but nothing else.
Exactly. So you don't notice it when you move or use your thumb. Only when you look at it from the outside, I have to get to it somehow with the gold. And we also used finely powdered gold as well, just to enhance the effect and to be able to work as extensively as possible on the small joint. But even if you notice it a little, which is sometimes the case with the small joints, I have to get to it somehow. It just doesn't bother, and it stays in for life and works for life. I always think that's cool.
Are there any risks involved? Or because there are metals, some people say, oh, that's really dangerous. Or is gold actually completely...
Yes, well, you know that I also do chelate therapy and metal measurements and so on. I have never seen that in patients where we have implanted gold in the form of pure gold, that we have subsequently found it systemically, that the amounts of gold have then gone up somewhere in the body. I have never seen that, and there are no allergic reactions to pure gold. There are for gold salt, there are for gold alloys, but for pure gold, and here we use fine gold, 999 gold, there is no such thing. So the effect stays where it is, but it does not somehow into the body and side effects. We have never actually seen, apart from what can happen after an operation, sometimes swelling, sometimes redness. Yes, a bit of bruising, but that's actually always been all.
Yes, limited in terms of time, accordingly. Yes, great. I'd like to talk to Dr. Burgard a little further and would show your picture briefly. He also showed you again where the injection points are. If you want, just stay. Exactly, because I believe that when we finish the recording will be deleted. Not that we're doing anything, but I'm not that much of a technical expert. I'm just trying to switch to PowerPoint for a moment so that we can see the picture. So please stay tuned.
Yes.
Exactly. Yes, so here we can briefly see the entry points on the wrist. And I went in from there and then distributed the gold over the entire area. And that was 4th degree osteoarthritis. 4th-degree osteoarthritis experience has shown that you can't treat it with anything, so that it really lasts in the long term. So not with hyaluronic acid or anything else, that doesn't really work. And that is always the indication for surgery. And the patient has, as she has already said, tried everything possible. And we just used microparticles in this special form, which have also been used in studies. There are various recent studies, I've listed them below, you can hardly read them, but there are various university studies that also show that it works. And we can see and hear from people that it works. And yes, here you can see roughly how it works.
Is this actually an old method that has been forgotten? That it's such ancient knowledge where people used to work with...
Yes, I mean gold has been used for thousands of years because it is the most powerful anti-inflammatory substance in the world. And the ancient Egyptians used to put gold smoothly in the brain for headaches, or gold around the teeth for toothache. And people have always worked with gold. And gold implants have been used in animals since 1983, and in humans since the end of the 1980s. But joint replacements have prevailed.
Yes, of course. Why do you think that was?
Well, that's just the way it is, isn't it? Yes, that's the way it is. Yes, good. Yes. So it worked for you too, as it did for hundreds or thousands of other people, even if you include your colleagues, other people too. That's super gratifying, and we wish you much success, and that it stays that way.
Yes, thank you for your time.
Thank you very much for your participation.
Yes, thank you very much, Ms. Huck. Ciao.
All the best. Bye.
Bye.
Yes. Perfect again, isn't it?
Yes, that's how it should be.
It's quite fascinating that you can actually use the gold to ultimately, without further intervention of any measures, this regeneration can really be achieved, or at least painfully.
Yes, because that's what the metal can do. It is the strongest anti-inflammatory substance, and it is always about inhibiting inflammation. And with that, the swelling goes away, the pain goes away, and regeneration can then also occur. But freedom of movement occurs when the pain is gone. And that's what people want, and what affects their quality of life.
If anyone would like to read a little more or have a look, Where can I do that?
Yes, they can go to my website, drburgard.de, and then look under gold implantation to see what we write about it. Look on the internet, under my films, we've already talked about a lot there, or simply call or write to us.
Super. Thank you very much, Harold.
You're very welcome.
And hopefully we'll see you again soon.
Yes, with pleasure. Bye.
Dear viewers, yes, if you suffer from this problem, or perhaps someone around you does, then it is of course wonderful that there is a very exciting solution here to achieve pain relief, and I hope you were able to take something away with you. Thank you for watching. See you soon.